So today we're going to have a Insta Live together with Yana Yutskovskaya, which is a professor dermatology from Russia. She is a very big name in Russia and actually globally. She's one of our experts. Oh, here she is. I'm getting her in. Just waiting for Yana to connect from us. I think she is somewhere in the seaside in Russia.
I'm very glad to see you. How are you?
I'm good.
Hi.
Good to see you. I can hear you and see you very well, so that's great. Thank you for joining me. I was giving a little introduction about you already. The connection is a little bit slow. Yeah, that's better. All right. So I was already introducing you that you're one of a big name in Russia for cosmetic dermatology, actually globally, a global expert in calcium hydroxyapatite. So our theme today is to look actually for individualization of treatment, right? Because it's one of your things. And one of the questions that came in, or that how do you actually look at a patient and how do you see what she needs, or how do you choose the product to be held?
For radius, you're speaking about radius now?
Just in general for your patient.
In general for my patients. First of all, very important, this is aging of my patient and everything about this life. First of all, now I live in Sochi because we have some problem with corona, such as in your country too. And I live in Sochi 2 months and work in my clinic in Sochi. I may say that here a lot of patients have a lot of pigmentation. And here a young woman have a lot of pigmentation. And next question, this is laxity of the skin, because all time is very sunshine. And now we have a temperature 22, 25 and near plus 22, 25, yes. And near the sea, this is a very big insulation for the skin. That's why all patients here in Sochi come into hydration of the skin. And first of all, what I recommend now, this is hydrate procedure for the skin. And I prefer procedure with Merz company product. That's why I recommend for my patient Bilateral Hydra now. And when we're speaking about collagen stimulation procedure, in my practice, first of all, this is a hydration of the skin. Because fibroblast is very interesting cells in our skin, and first of all, fibroblast must be such as in a good restaurant before collagen stimulation. Exactly. That's why now I recommend for my patient one syringe, and one syringe with bilateral Hydra.
Mm-hmm. And how do you apply the Hydro? Do you do papules?
Papules. I prefer papules because this is native hyaluronic acid, and papules technique is more better, I think, for the skin. Yeah. After 2 weeks, for this patient, I recommend, because very sunshine, I recommend botulotoxin. Because I understand that all patients do everything in this sun, and that's why my patient don't want have a not beauty color of the skin, and I recommend botulotoxin for all face. I do not do some region of the face because this is not wrong. This is wrong. I do only all face and sometimes with neck. And next procedure after botulotoxin after 2 weeks, and sometimes I do everything in one session. You see, because I understand this is not problem for the skin, but if this skin is sick, I prefer 2 weeks before for hydrate. After botulotoxin, I recommend for my patient radius in diluted variant, and for the skin of the face, I recommend diluted 1:1. sometimes 1 to 2, because if my patient have symptoms of dermatoporosis of the skin, this is angiopathy of the skin, cuperosis, a lot of pigmentation, thick skin. All these symptoms I recommend for the face 1 to 2 diluted.
1 to 2, okay. So if the skin is more fragile, already has a pathology and cuperosis, it's thin, it's like paper-like.
Yes, like paper.
Dilution.
Yes, I want hyperdilution, but we must understand that dilution is important, but more important, how much radius we take.
Yeah.
That's why we must understand that for the face, this is 2 syringes, 1.5, or 1 syringe, 3.0. I don't know, because a lot of countries, a lot of variants of radius. In my country, we have 0.8, 1.5, and 3.0. That's why for the face, only face, without neck,
3.
0 radius. After you dilute it, you may dilute 1 to 1. That's why you will do, you can do 3.0 radius, 3.0 saline solution.
Yeah.
Sometimes I mixed with lidocaine, but only for anesthesia. If I do this, I take 0.5 lidocaine, 1 or 2%. That's why when I take 3.0 radius, after diluted 1 to 1, I have 6.0. If I dilute it 1 to 2, I have 9.0. It's very good product.
It's super
But
good
only
product.
for the face. Only for the face. Because if you take 3.0, you do all body, you don't have any result.
No, we know that. So one of my things that I really like on your approach is that you first, before you start fillers, you actually make the skin healthier.
Yes, all time. Because I understand all time. First of all, this is health of the skin. And this not only age, because we know that we have a patient after 15 years and without laxity of the skin. And we have patient 25, 30 years, and she speak with me about laxity of the skin. This is genetic determination of the health of the skin. And I may say after my practice that men patient more better for collagen stimulation than women.
For sure. And then my other question is, so this is a whole procedure you do basically on every patient. First, you look for the skin that is hydrated, right? Despite the fact that she's going to be young or mature. How often do you do this package?
You see, I think that we must do this twice in a year. What about hydration of the skin? This individually, but for my patient, I recommend this twice in a year.
Twice a year, good. So twice a year, she's every 2 weeks. First hydration, then toxin, and then radiance.
Yes, if patients speak with me about laxity of the skin, sometimes radius, I recommend 1 is 3-4 months. You have some patients such as I with very big laxity. After this patient with not so strong symptoms, this is 8-9 months. And some patient, this is young patient, this is 1 in a year and a half.
Okay, perfect. And a lot of people ask me, when do I see the effect of the hyperdilute radius? Because our patients don't see it immediately, and it's difficult for the doctors to sometimes sell the procedure.
You see, immediately patients will see result, but only for edema, not for the result of collagen stimulation. But we know after our research that first collagen stimulation we have only after 2 weeks. This is first step for collagen stimulation. After 1 month, we will see first result. And maximum result we may see after 3-4 months, because after 3-4 months we have higher data for 3 types of collagen. This is young collagen.
Mm-hmm.
This is and this is a result for elastin, but not quantity, but quality of the elastin.
Yeah.
And when we speak about laxity, this is quality of elastin, not only collagen first and 3 type. And after 8 and 9 months, we understand that 3rd type of collagen stayed first. This is a long-term effect of this procedure.
All right. And then if you need dermal fillers, how do you approach that? Do you approach it after your healthier skin, or do you do it all in one?
You see, sometimes I do it all in one, because in Moscow, patients don't want coming next time after 1 month. They want beauty, and that's all. And that's why if I work with fillers for volume, in my practice is bilateral volume.
Yeah.
I do everything in one procedure. Periostal technique for volume technique. This is bilateral volume. And for laxity of the skin, for quality of the skin technique, this is radius. And I did this more than 5 years for one procedure. I don't have any problems with my patient.
No.
Sometimes I do this everything with botulotoxin. And I think that's very good, because botulotoxin, this is very separately procedure, only for neurons, only for the muscles.
Yeah.
That's why we may combine this for volume, bilateral volume, for muscle, botulotoxin, for skin, radius and diluted.
Yeah. And another question I have, which is, I think Russia has a much better way of looking at it. You guys treat full face botulinum toxin, right? The rest of the world, and I can say that because I've been around the world, except for Asians as well, we treat per zone. I changed my practice recently, and I loved the results. Can you explore on that one more? Why do you decided to just not to treat only 1 zone or 2 zones, but just go for the full face? Because I think it's a very interesting thought process you have. I mean, I know it because we had this conversation before, but I think it's good to put it out there that toxin is not only for 1 zone.
You see, muscle of the face is very different from muscles of the body, because muscles of the face have 1 point for bone and 1 point for skin. That's why when we speak about emotion of the patient, if I block only upper of the face, I do all my emotion lower of the face. If I ask you, how are you? And I block here, I will say, how are you? Because here I have a lot of mimic emotion, because I block here.
Yeah,
that's why this is balance of the muscle activity and emotion. That's why I recommend for my patient, and more than 10 years, I work only all over the face. In our country, Bokutur, in your country, Xiamin Bokutur?
Yeah, Xiamin Bokutur.
Bokutur certificate for the lower of the face. This is this line. That's why Nefertiti line I prefer, because this line for the lower of the face is the best in botulotoxin. Neck is don't registrate too.
No, it's off-label use. Yeah,
it's off-label in my country. But you see, I can't have beautiful result if I don't work with the neck with botulotoxin, because if my patient have a lot of platysma bands, this is not beauty. No. That's why we'll do this.
All right. We do this. I know we do this. What sometimes happens if you treat the platysma and the Nefertiti, people get a little bit of laxity of this submental skin.
Yes. We understand that we have some more laxity or some more problem with the fat.
Yeah.
That's why sometimes my plastic surgery do here liposuction, or I recommend for my patient lipolytic here. I prefer lipolytic from SkinTech Pharma Group, Spanish lipolytic. Very good result, not very comfortable, very short rehabilitation of the skin. After, I recommend for my patient botulotoxin, and after, I recommend for my patient radius for this zone. I work here submental zone. I work here with cannula 22 on 25, and I recommend you for this zone 1.5 diluted 1:1. Result is very beauty. If you have magic machine, this is ulcer therapy. If you have magic machine in your clinic, I have 3 magic machine in one my clinic, because in one flat this is one machine, in second flat this is second machine, because all doctors won't work with ulcer therapy. I recommend for my patient ulcer therapy for this zone, because we know that this is the most beauty result. This is neck and submental zone, because some patients have a lot of fat here, and we have soft faces, and not all time we have a beauty result here with ulcer therapy, but in submental zone and neck zone, this is the best area for ulcer therapy.
So when do you implement the therapy then? Is it
in this situation
or last?
Ladies first.
Ladies first.
But botulotoxin first, because platysma bands, this is activity of the muscle. That's why I must do first. This is activity of the muscle, and next platysma, and next ulcera, and next radius. Ulcera therapy and radius I prefer in one session, because this is a lifting of the mass and lifting of the skin together. This is hit in my practice now for all patients who speak with me about lifting. First of all, I say that I want the same. In the morning, I stay near the mirror, do this, see 5 minutes, and after go to the clinic. But every patient want lifting. Every patient.
This is the first one they come in.
Yes. That's why I recommend for my patient ulcera and radius. This is the hit of the practice today.
Yeah, I know. We have the same. It's people say it's a big investment in the beginning, but that big investment is you'll win it because the results are there if you use it correctly, of course. Then I know you have a few tips and tricks if you have filler left, right? Some people say, do you always use all your dermal filler? I said, well, not always, because you told me to do some tips and tricks. I know. You put something in the ears.
It's very interesting technique, because when my patient asks, what about my ears? I say, you see, if you have very big brilliant, you must have very beautiful place here. For your first time for your not girlfriend, what is it in English? I know when подружка. Girlfriend. Yes, but if it's 2 girlfriends, what is it? Подружка in English, what is it? Boyfriend, girlfriend. But what you, Dasha, you my girlfriend? No. Who are you for me?
Yeah, I'm your girlfriend.
Girlfriend. Okay. If I want for you 3-carat brilliant, I must have very beautiful hair, yes? That's why I prefer here hyaluronic acid. I prefer here bilateral balance. And I recommend it with lips together, because when we work with lips, we have now very beauty product. This is bilateral lips, and we may do with bilateral lips and small volume for the ears. This very beauty together.
I know it is a trick I always do. It's very important. If you want to wear earrings, you need to treat them. Otherwise, I have a patient one is quite interesting. We treated her and she went to the massage, and that guy was like, Yeah, and you know what? I always look at patients, I always look at their ears, how old they are, because you know the face can be beautiful. And she said, but your ears are also young. And she said, yeah, my doctor told me, you have dried out ears. You need to put some hyaluronic acid in your ears.
Yes, sometimes you see for men, I prefer radius here because
Radius, okay.
men, yes, degrade hyaluronic acid more quickly. That's why I recommend for men radius, and this is 0.1, 0.2 from one place. Result is very beautiful.
Beautiful too. And do you dilute it?
No, for the ears, no.
For the ears, no. Okay, great. Okay, then I have another question for you, right? Now it's hip and happening, the lateral lifting. How is that in your practice?
You see, I prefer temporal lifting today, and I will do a lot of soft patient because here we have a very interesting place. After research of Sebastian Catafana, we understand that this place work with volume here, with laxity here, and this place all over for all face. This technique for all face, because we have some ligament here, fixation of this zone. That's why I prefer now temporal lifting here, and I work here not with hyaluronic acid. I prefer here radius. And I know that this is not volume. First of all, this is not volume, because if I work with volume, I prefer bilateral volume. Here I prefer radius, and not somebody write me this point fixed. No, this is not point fixed. This is ligament fixed. This is another point fixed. This is a term of another speaker. Ligament. That's why I prefer radius here to up down smash, subsmash or subdermal.
Yeah.
If I work up smash, subsmash, I prefer radius diluted 1:1. Sometimes I don't dilute it. Why? Because some skin is very muscular. If I have muscular skin, I do not dilute.
No.
If I work subdermal, I dilute it all time, because here is very thick skin in my patient with a age. That's why I prefer dilute. What point is very important, because some doctors work with this point. No, I work with this point.
Yeah,
this is McGregor point. Yes, McGregor point. From this point, I work with all these. I have pen. From this point, I work with all this area. This is zone C3. Yeah. For the two lifting. This is very beauty effect. Yes, we work here subdermal or smash, and here we work only subdermal. I prefer this technique with radius, and here I dilute it sometimes 1:1, sometimes don't dilute. And here I prefer diluted 1:1, and for this area 3:0. Oh. In this situation, I have very beauty face for my patient, because I don't do here any volume. Volume here we have a lot. You see our face, we have a lot volume here. And here we have edema of the fat. That's why I prefer this technique now. This very beautiful technique and very pathophysiological for our face.
Absolutely, and I think this is such a good trend coming up. You look beautiful, by the way.
Oh, thank you very much.
It's a good trend coming up, because you remember we started all medial. We started to fill up the malars. Then what happens? We got festoons, we got edema.
And when we do this, everything is stay.
Yeah.
This is not beauty.
No, and I think Sebastian Cotofana gave us an amazing research paper on that, and thank you for your contribution as well. That actually we have to put laterally, and you know, with our patients, they all start lifting from lateral.
Yes,
So
all
this is the place where we have to start lifting and doing.
And we lost volume here. You see, here we have a plus volume. Here we lost volume. And that's why we may work here in this place of the face, zone S3 for the volume. It's very interesting, yes, because first of all, we say that here is we mustn't do volume. No. Now we understand that here volume and here lifting.
Yeah.
Another paradigm of physiology of the face. And next step, this place for botulotoxin for Nefertiti line. Why? Because here we have a new volume and lifting, and here not every face want a volume. That's why when we do here 4 points with Nefertiti lines, we have such volume here. You see some beauty, natural volume, because here we treat hyperkinesis, and here we have a volume, natural volume, not after filler. And only next step, this is volume of the lips.
Yeah.
But very natural too.
Very natural too, because we don't like those big lips.
We don't like big volume because it's promiscuity.
I don't know how to translate that, but that's absolutely true.
This is very sexy.
Yeah, very, very sexy. Okay, I had another question for you. So how is it actually going there in Sochi? So in Sochi, you're allowed to work, or?
Yes, we may work here 2 weeks, and that's why we sit 1 month in the home. But you see here is sea, sunshine, very beauty, not so bad situation such as in Moscow. But now I work 2 weeks in my clinic, and I'm happy because my patient come to me, and this is very good for me because I can't sit in the home. You see, this is my problem. I can't sit to one place. I want to London.
Well, you know, I'll tell you, London, we're closed. I mean, I'm in Amsterdam now, so our clinic's opened in Amsterdam, but London is probably closed until July.
Okay, I think that maybe in June we speak with you once again about something interesting.
Yes,
if you want, with pleasure. Thank you very much.
Thank you for your time.
Therapy. Now I must go.
Yeah, that's why.
Thank you very much.
Thank you,
Daria,
Yana.
thank you. Bye, everybody.
Bye.